I'm an outreach librarian for the National Library of Medicine, and I'm going to give you a very, very brief overview of a few of the resources that we have at the National Library of Medicine that will assist you in your HIV/AIDS work. So let's begin. We're the world's largest medical library. I love doing this because it shows off all the numbers. 17 million items in over 150 languages and 50 miles of bookshelves if they're laid end to end. A bulk of the National Library of Medicine is actually located underground, and we are on the campus of the National Institutes of Health in Bethesda, Maryland. If you're ever out, it's worth seeing the collection. But more than just being a traditional library, we also offer 230 online and mobile resources and databases that are freely available to anyone with internet access. As you can see, this is just a few of the information resources that we cover. Clinical trials, HIV/AIDS information, AIDS info, which we'll be discussing today, health hotlines, toxicology information, Lactamin, which is actually is for medications effects on breastfeeding women. Just an amazing variety of information. Who uses us? Researchers, scientists, health professionals, and I'm sure people like you, and millions of people use us every day. What we do is we collect, organize, disseminate, and preserve health-related information. We conduct and fund research into new ways to record, store, retrieve, preserve, and communicate health information. And we also are heavily involved in training and education. Okay. And key to this is we're not just one library. The National Library of Medicine actually has a network called the National Network of Libraries of Medicine, NNLM. And what it does is it provides information access through our 5,000 member network, which includes university libraries, medical school libraries, hospital libraries. We provide access to health professionals, the general public, students, AIDS service organizations, for if you need hard copies of articles. We also offer more than just that. We also offer training. If you're looking for more in-depth information on some of the databases I'm going to discuss, they offer training both in person and through various webinars. Also, NNLM associated libraries also conduct outreach efforts within the community. So if you're scouting, you're going to have a regional conference and you want the National Network of Library of Medicine to participate, they can be there. They can set up a table. They can disseminate information. They also offer funding to various organizations, so you can, be funded to use NLM resources in your daily activities. So they can do it on a local scale, local level scale. Some of our previous funding projects from NNLM, are the use of mobile apps for HIV/AIDS information. One of the network offices conducted that, or the use of low literacy materials among certain populations. They will help. They offer funding several times a year, and they will, of course, see you through it. So again, check out the NNL website. Look around, look for resources, look for trainings, and also look for funding opportunities that are available. Now, the databases that I'm going to show you, I'm just going to show you two today, PubMed and AIDS info. You can find them by going to our homepage. There are multiple ways. You can use the search box in the upper right-hand corner in red, or you can go to the database section and click on the database if it's PubMed or one of the more frequent ones, or there's also a listing of all of our databases and APIs. And here's a URL, just in case you don't know it by now. Okay, the first one that's discussed is AIDS info. Now, AIDS info contains the federally mandated what they call the treatment guidelines. That's the key to it. Originally was started to just house the federally approved treatment guidelines. However, over the years it has grown, and also it offers an immense amount of content. A lot of people just remember it just as guidelines. No, there's much more to it, and I'm going to show you what it has to offer. But first, we are going to obviously discuss the guidelines since they are key to the whole thing. The guidelines are arranged, of course, by topic, adults, prenatal, perinatal, things like that. There's also, if you notice in the upper right-hand corner, there's guideline news in case there's any new supplements or releases to the guidelines. We also have information on what we call released content, which is supplemental information on the guidelines, such as fact sheets, and also have slide sets in case you want to use them in a presentation for yourself instead of having to go through and comment. There's already pre-created content right there. We also offer past guidelines and what we call the archive guidelines section. So let's take a look. Now at the current guidelines, as you can see highlighted, get up a little larger. Let me see. We're on a time delay. I'm on the East Coast, so there may be a little bit of a delay in here. Okay. These are the current available guidelines for using antiretrovirals. As you can see, it's available also online as well as PDF format, where you can break it down in specific sections if you need to, or have the full PDF, also the recommendations, and just the tables. It's all broken down to make it much easier for you to use through the information. You can also, in these select guidelines, pick what specific one, what aspect you're looking for. I'm going to look at the perinatal guidelines. And see within there, I'm also typing in HIV testing. So I can search within that specific guideline, which makes it a lot easier than having to comb through, having to do a simple word search through a PDF, or have to search the entire guideline and have to comb through the results. And these are the search results within the perinatal guidelines for HIV/AIDS testing, for HIV testing. As you can see, it gives you specifically, it'll take you to that specific location, as well as also it gives you the URL in case you need to like cut and paste it and put it into an email or something like that to send out quickly. So therefore, you really are going from a massive guideline down to very specific with just a few quick clicks. Next, we're going to look at clinical trials. Now, clinical trials on AIDS info is actually it's a subset from clinicaltrials.gov. We work, the National Library of Medicine also funds clinical trials as well as, of course, AIDS info. So we decided we wanted to pull a subset out of there just because it would be easier and for also a more focused search. As you can see, you can search by keyword, you can search by category, and then of course that's broken down into things like an example here is we have cancer opened up, and you can see you can search by AIDS defining cancers or cancer and HIV. If you look to the upper right hand corner, you'll see clinical trials news. If there's any, and below that again, clinical trials resources, which will take you to more NLM resources discussing that. And with all of our databases, if you need help, there is a 1-800 number to call, and of course email. Email turnaround time is 3 to 5 business days. So let's do a search. I'm going to search on testing. HIV testing seems to be my theme. Now this is interesting because you'll see the results of all the trials that are being offered that include testing. And as you notice, a large portion of the top ones are either completed or they're active and they're no longer recruiting. Now if you look at the very bottom, you'll see the one starting with implementation of nucleic acids. You'll see that that one's recruiting. Now if you want to separate out, you want recruiting tests, you can easily do that by going up to the upper, right below clinical trial results, and refine your search. And that's just a simple, you can remove the ones that are completed, and that will only give you searches that are recruiting that are active. Again, we show them all because it seems from our usability studies that actually people want to see what's finished, because they also want to see if it's completed, when are they going to publish their results. Next, let's move on to the drugs, which consists of information on HIV/AIDS related drugs. We're really fortunate in the sense that it's not just FDA approved drugs, but also we list investigational drugs, which not too many databases do. As you can see, you can search by drug name, drug class, approval status if it's still there. We offer an A to Z index, which you can search for brand name and others. You can have, of course, drug news, the most up-to-date news with anything that's being released. And we also have more about drugs, which is really a lot of kind of information geared towards the patient. So these are great ways to find handouts in place if you're in a situation where you need to find information to disseminate. I'm going to search for ritonavir. And these are the results. As you can see, it's not just basic information, it's the basic information, but also it's more. We include images of the drugs. Even including the packaging. Chemical information for physicians and pharmacists. And also for users, we include in the lower, you'll see there's a warning. We include any kind of warning labels in a prominent position so people, will have them right up front. Unlike a lot of package inserts, these of course are written in obviously larger typeface, just to give you an easier way of looking over and consuming the information. As like I said before, we also offer material on approved drugs as well as investigational. Okay, now I'm going to look at the HIV/AIDS health topics. This links to HIV/AIDS related resources from the federal government. This is again one of those things where it's like we're not just giving you information that's suitable just for patients, just the clinical guidelines for physicians, but we're trying to broaden it so you have information resources for, the AIDS service organization, the community-based group, people, general public, those who are just recently diagnosed, and also information on specific, other groups, women, children, aging folks, African Americans, pregnant women. It's all we can break it down by related condition, specific population, general information, treatment resources, clinical research, information specifically for researchers. So we really have a really wide range of health topics here, and of course this is all populated by federally approved information. So by sending, if you want clients to search this or you want to find information yourself, that this has already been reviewed and vetted as, of course, being approved by the federal government. Okay. Well, I'm going to search again for, looks like I'll be searching for testing. Yes, I will. Ooh. That is strange, because it just skipped my testing results slide. Well, odd. But anyway, the slides I do remember, it called up all the resources that we had from testing, from CDC, from National Institutes of Health, so you can get an idea of where those materials are from. Also, we offer listings of educational materials. Now again, for those, we have, other materials like, brochures, handouts, fact sheets, materials in English, Spanish, and those in other languages that, of course, have been approved by the federal government. And finally, I'm sorry about this. It seems like some of our slides are not showing up, are the mobile tools and resources. Now, we offer apps on the HIV/AIDS AIDS info glossary in both English and Spanish, widgets, APIs for those who want to, allow the programs to access our tools and databases. Our apps are AIDS Info Mobile, and also, more importantly, aside from the glossary not being only being available on Apple, it's also available on Android, which was one of our big issues. You can also order hard copies of our publications too. So it's not just mobile apps. It's also, we do offer, for those who still need it, hard copies of the glossary. A new version of the glossary hopefully will be out in time for U.S. Conference on AIDS in Washington, which will also feature images, which is kind of a new thing. And of course, naturally, the apps will be updated to reflect this too. Now I'm going to discuss PubMed. PubMed is NLM's premier online database for the biomedical literature. This is the materials from not only the biomedical journals, but also In recent years, we've been adding materials directly resulting from that are not yet published from clinical trials, materials from individual book chapters, as well as monographs. We've been adding a lot more content to PubMed over the years to make it much broader in what it used to be. Many of you are like, oh, that's just the journal literature, and it's only just abstracts. It's a lot more than that. You know, what is I'm going to answer these questions. What is PubMed? Why should I use it? What is in PubMed? And what's the best way to search for HIV/AIDS information? As I said, PubMed is the largest the largest citation database. More than 22 million citations. You can search PubMed by entering your query right there in the top box and clicking search. You can enter phrases. You can enter just topics. We also offer a massive collection of resources and tools, materials on using PubMed, from quick start guides, information how to access full text articles. We offer tutorials. We offer, obviously, Medline Plus is available on mobile. We offer the single citation matchers. We offer topic-specific queries, which I'll be discussing. We have resources on MESH database, which is the medical subject heading. There's so much here that I wish it would take me 2-3 hours just to explain one part of this. I mean, really, PubMed is really one of those things where it's very simple to use, but it really actually does take, you know, quite a bit of time to learn to master it. And don't feel lost either, because we do offer, like I said, with our quick start guides, tutorials, and being able to connect with via phone or email to our customer service staff information. We can provide you with information how to search better. We can, give you clues, tips. We can help you conduct research. We can let you know, again, through the national network offices, you can find training online or hands-on in person. And of course, more information on not only PubMed is also part of a larger set of databases managed by our National Center for Bioinformatics. So they offer a lot of quality information. So you can use PubMed to find reviews on effective needle exchange programs. Articles that discuss whether PrEP can reduce one's risk of being infected. Articles that discuss the latest information on page management, pain management. You can find this kind of information. You can find additional information, delivery of healthcare, nutrition, pharmacology, evidence-based research. So let's locate an article that discusses the latest information on pain management with patients with peripheral neuropathy. What I'm going to do is I'm going to type this query into the search box. I'm just going to use the whole phrase. You can use phrases, you can use parts of phrases, you can also combine search terms using Boolean operators, and for those who are non-librarians, those are and, or, and not. But I'm going to use the phrase because that seems to be the easiest way to do it. Okay, now these are my search results. Yes. As of the time of 3,529, I'm going to take a look at a couple of them. So this one is interesting, but if you look, it doesn't seem to mention HIV/AIDS. But there are some other features here that I want to discuss before we get into that. If you find an article you like, there's a link called Related Citations, which basically formulates an algorithm looking for similar terms that appear in that article. So conceivably, if you can easily find, and that way you click on that and it'll find more like-minded articles. Sometimes that's a very great way of searching without having to do a lot of effort. And then you can go from one related citation to another, kind of finalizing or finding what you're looking for. Also, the more important thing is which articles are free. Now, full text does not necessarily mean free, but free full text does mean free. We also have free articles from what's called PubMed Central. This is the repository of journal articles, again, like I stated earlier, that are from clinical trials that are finished and not yet published, but they are provided to us free of charge. It's also a great place for an archive of older articles. PubMed offers filters. Now, filters are a great way of taking and narrowing your search down, particularly if you have a large search topic. And the one I'm going to specifically discuss, and of course it's very relevant for all of us, is the NLM AIDS filter. Now, you can find the AIDS filter by clicking on Show Additional Filters, then clicking on the topic Subjects. Third, you click on Show, and that'll show actually on the underneath Subjects it'll say AIDS, and then that means that once you click on that, you've activated the filter, and what it will do is it will go back and apply that filter to our query, and as you can see, I'm trying to say. We've narrowed it down from 3,529 items to 87, but that 87 is specifically related to pain management of peripheral neuropathy as it relates to HIV/AIDS. Applying the AIDS filter either before you begin a query or after can really narrow your search down. As you can see, it'll help because also if you look over there, you'll see the titles specifically with our search terms. Another important thing is you can also see the listing of how many free full-text articles are available using our specific search terms with the AIDS filter. You can find related data sets. There's a listing of data sets that may be of other databases that maybe have other information. These are other NCBI databases. Many of them are genomic in nature, so that may be of some interest. And then for those who still like searching what we call the old-fashioned way by doing long string searches, it shows you exactly what terms were searched. And thank you very much. I know that this was a very brief overview, and I'm sorry that one or two slides were missing for some strange reason. But as I said, we at the National Library of Medicine are here to help you. Let us know on all of our pages. There's called a Contact Us, reach out. We are more than willing to help you with anything you need. Thank you very much.
Now we'll switch to Kenyon, and we'll do all questions at the end. But I want to say thank you, Andrew. I have spent a lot of time on PubMed and didn't know a number of those features that I will now be using in my feature searching. So
that's great.
Excited for that. All right, I'm going to introduce Kenyon Farrow. He's the U.S. and Global Director of Health Policy for TAG, which is Treatment Action Group. Kenyon is a long-term writer, thinker, and all-time smart guy when it comes to HIV activism, research, and policy. And I'll let Kenyon take it away.
Sure. Thank you so much, Matt. Just to tell folks who aren't unfamiliar with Treatment Action Group or TAG, we're a research and policy think tank based in New York City that focuses on research and advocacy, mostly towards treatment access and vaccine and cure for HIV, and we also work on TB and hepatitis C because of the impact that those two diseases have on people living with HIV, both in the U.S. and globally. So a lot of what we do at TAG is actually sort of take data and critique data and look at data, or sometimes create our own data to do various kinds of activism and do campaigns to change, administrative policy and sometimes legislation. So I'm going to focus. So I'll say this, just a couple other things that we are have done recently that I think sort of fit in this ballpark. We do an annual pipeline report where we look at what new either drugs are coming down the pipeline for treatment for HIV, TB or hepatitis C, and things like that. So we publish that every year. We publish a research and development report for TB, looking at how government agencies across the globe, pharmaceutical companies, and even private foundations are spending money towards research and development for for TB. But I'm going to focus for this call on a project that I'm directing right now that we're actually in the middle of research, the research phase, to produce a report that will ultimately also lead to some advocacy and I think is very relevant to those of you on the phone from BAI or BTAN as a community mobilization project. So next slide. So the project that we're working on is a research project looking at the role of community mobilization in CBOs and ASOs across the country. And, so just to give you our sort of definition of community mobilization we're working with, we're talking about building the capacity of affected communities to foster collective leadership, ownership, input, and our participation in strategies to accomplish one of two goals. So one is service utilization to increase engagement in HIV prevention and care services, and then two, advocacy, so mobilizing clients and community members to advocate for better policies and funding for HIV-affected communities. Next slide. So part of the reason why we decided to do this project is, there's a couple different issues. So one is, we know that there's a kind of changing set of priorities for HIV prevention and care that directly impacts, AIDS service organization and community-based organizations. We know that because of, biomedical advances, in prevention, the whole concept of treatment as prevention and then pre-exposure prophylaxis happening, the CDC's kind of shift to focus on high-impact prevention and how that's impacting funding resources around the country. Certainly the Affordable Care Act, rollout or non-rollout if you happen to be in a state that is refusing to expand Medicaid. And we know that, kind of stigma still exists that, education of impacted communities on some of these biomedical advances have not kept pace with the advances, right? So I have this experience all the time of being, with cab drivers or Uber drivers in different places around the country. Folks ask me what I do, and I talk about the work. And if I talk about, PrEP, for instance, I mean, people just don't even know that this is even a concept, let alone that it's actually somewhat available. So, so those are some of the kind of issues, and I think the other piece that we really wanted to look at was, or what drove this project is, there's actually not that much known about the value of community mobilization in the United States. We don't have any core indicators. We have very little research on community mobilization models or strategies in the U.S. If you Google community mobilization and HIV, you'll come up with a lot of, papers from organizations or peer-reviewed journal papers written about how community mobilization models, in sub-Saharan Africa or in South Asia, help scale up, prevention efforts and treatment access and so on and so forth. But we have almost nothing, published in probably the last 15 years. There's very few things that have looked at community mobilization models in the United States. And we also don't have very many evaluatory tools for, community-based CBOs and ASOs to even look at how their community mobilization work has impact in relationship to, maybe their service provision or clinical goals, right, along the way. So that's the sort of basis of why we're doing this research and what will become an advocacy tool after we finish the research. Next slide. So, so I put this slide in here. So we're thinking about kind of ways to use data, for a kind of advocacy purpose. And I actually took this from a government agency. It was actually from a Dave slide. So, if many of us on this call are familiar and probably sick of seeing the treatment cascade or the HIV care continuum. So we understand what those bars are. But if you look at this slide, what I thought was really useful from a kind of advocacy point of view is that, they're sort of thinking about it. This is about, kind of how behavioral and social science research is really important to addressing some of the issues along the cascade. But I also think that it's important because it actually, to me, expresses a kind of a social justice agenda, right? So if we look at, the sort of clinical outcomes and we see things that impact the clinical outcomes, right? So from everything from knowledge and risk perception, motivation, self-efficacy and management, over to the other bars, where you see stigma, immigration status, insurance or access to care, housing and food security, substance abuse, social isolation. These things are sort of things that prevent us from raising those bars, right? So I think this slide is, you can think about it one way in your local work. This is the kind of thing you can use to show to policymakers, to elected officials, to community members to sort of help make the point about why we need to scale up our efforts, both in kind of, access to prevention and treatment methodologies, but also these sort of, services that, and potentially policy and law that impact, people's ability to access, these other areas that impact their treatment outcomes. Next slide. So just to give you some of the goals of this community mobilization research project we're doing. So one, what we wanted to do was to document effective community mobilization strategies in 10 metro areas highly impacted by HIV and amongst communities most impacted. Two, to characterize the added value of community mobilization to addressing the disparities in achieving success along the treatment cascade. Three, to influence funders and researchers to support the development of key indicators and evaluatory tools for community mobilization. And lastly, to organize a coalition of stakeholders to create and advance a research and policy agenda towards supporting community mobilization efforts to end the epidemic in key jurisdictions. Next slide. So here's some of the things that we've done to date. So we started this project about a year and a half ago. So in January 2014, we created an advisory board of key stakeholders. And what we did with that advisory board between January and July was to help to get a bunch of folks from different parts of the country who come at, HIV prevention and treatment, all who have a sort of foundation in community mobilization, but who have various kinds of expertise, both as, sort of from policy, as community organizers, as service providers, as government officials in health departments or at the federal level, come together and start to think about what a sort of consultation would need to look at to help us further develop this project. And we, as TAG, we often do this before we publish publications. We will we'll put together an advisory group, develop a consultation, have a consultation to get the best kind of guidance from a cross section of stakeholders before we publish a document, and then before we then embark on an advocacy agenda based on that. And that model can be used in your community-based work as well, right? Many of you may be doing that. You sort of bring folks together to figure out kind of what the issues are and how you should attack it, and maybe, if you're going to publish a report or whatever, and then use that as the way to sort of launch the advocacy. So we had the consultation in July 2014. Folks gave us a lot of really great feedback, and one of the things that they said to us, because initially we were just like, oh, we're gonna just pick some cities and and kind of figure out where to go. We had this dashboard we created based on a lot of the epi data in of the cities around the U.S. And so folks said, well, wait a minute, you should slow down. You should actually maybe do a survey to a number of AIDS service organizations or CBOs around the country and ask them about their community mobilization work. And so we said, oh, that makes a lot of sense. So what we decided to do, so we developed a survey. We sent the survey last fall to about 335 ASOs or CBOs around the country, and we had about 130 respondents, which is actually a pretty good number. So then after we sort of then analyzed the data, I'm going to show you a couple slides from that broad survey. we did some follow-up calls to 20 organizations to get more data. Some folks who didn't quite fill out the survey. I know folks get sick of filling out surveys, and a lot of times the pieces where we're asking you to not just check off boxes, but actually give us, more statements or written, statements about different pieces. People don't have the time to fill out. So we did some other calls to follow up with organizations to get more data, and we narrowed in that list of cities from 15 cities to 10 that we would really focus on the sort of next steps of, and you can see those cities there. Next slide. So just a couple things from the survey, right? So again, we surveyed broadly initially 15 cities, about 335 organizations, about a 0.8% response rate. And next slide. So here's some of the kind of results of it. So we, one of the things we asked was, does your organization have a policy or advocacy program or staff, right? And you can see a majority, more than 54% said no. Next slide. Does your organization have one or more CAB, a community, a client working group, or a similar input body? And most of them said yes. Next slide. Does your organization have guidelines or action plans describing community mobilization methods, right? So we had about 48% say yes, about 52% say no. Next slide. Is your organization, so that was about, kind of, the first one, I'm sorry, was asking about guidelines for community mobilization for kind of increasing, access to services or increasing demand for services. This one was, do you have an action plan describing community mobilization for, doing more sort of policy advocacy work, right? So, about 50%, 51% said yes, and about 49% said no. Next slide. And we asked folks, are you a member, your organization a member of any local, regional, or national coalitions of social justice organizations, right? Many said yes. Next slide. And then we asked folks, okay, so what are in some categories of what kinds of coalitions are folks involved in? These are some of the responses. Most folks involved in, some sort of coalitions of folks who are people living with or at risk for HIV. There were a lot of folks who also were involved in sort of LGBTQ coalitions, about half involved in, organizations or networks involved in homeless issues, so on and so forth. Next slide. Asked a lot of folks about challenges you face in supporting your community mobilization efforts. As you would probably guess, a lot of folks identify insufficient funding as the #1 reason or the #1 challenge to doing more community mobilization work. Next slide. Again, first slide was prevention in terms of community mobilization. This one is linkage to care and retention. Again, insufficient funding for community mobilization in that area. Next slide. This is behavioral and biomedical prevention services. Again, insufficient funding. Next slide. Policy and advocacy, insufficient funding. Again, next slide. This is a recurring theme. Some next steps with things that we're kind of working on now. So basically, from this past, April to roughly the end of July or part of August, we after doing the broad survey and then doing the phone calls to sort of get more information out of about 20 organizations, we then did site visits with 33 ASOs in 10 cities. Where we, asked, most interviews were about an hour and a half long. We asked folks about, a range of their sort of community mobilization work, the history of the organizations and community mobilization work, what the work looks like now, what some of the challenges are, so on and so forth. So now we're in the process of doing we recorded those interviews, had them transcribed, and so now we're in the process of doing some data analysis, and about how do we, sort of characterize, what people sort of gave us in these interviews and quantify that. Then starting too soon for me, but what we will be doing is writing an interim report that'll be released on World AIDS Day this year. So, you know, you'll hear more about the sort of methodology, the background, everything that we did to this point, and what some of the key findings have been, you know, based on our kind of initial data analysis. Then in early 2016, we will start. We decided we didn't think about this in the beginning, but we realized when we were interviewing CBOs that we really needed to interview some of the intermediary organizations. So organizations like, you know, Black AIDS Institute that is supporting the sort of BTAN as an organization that we should interview about their kind of strategy for supporting community mobilization work around the country, and other, you know, other sorts of, you know, networks like that we'll be reaching out to. And also, you know, interviewing, you know, CDC has funded community mobilization efforts around the coast, also to find out from CDC how they have paid for those. And for folks who are interested in using that kind of data, and we heard in our first presentation, but also you can, oftentimes with CDC and HRSA, like their, you know, the grants that they've given over the years are online. So sometimes you can look at what they've actually funded and then do things with that, you know, with that data, right? You know, to make, you know, whatever sort of advocacy arguments you want to make about kind of gaps in things that have been funded or what have you. So finally, we then will release a final report next year. I'm hoping by International AIDS Conference next summer is my goal, that report, which will detail all the sort of final findings, and then some of the details from the case study organizations that we did in those 10 cities, and then to develop an advocacy plan, you know, with coalition partners. Next slide. So how we're specifically using this data, or how we plan to use this for advocacy. So one, you know, we want to do briefings with funders to advocate for more resources for community mobilization work, right? Two is working with ASOs and CBOs to share community mobilization strategies and evaluatory tools. I think a lot of people we interview were really excited to be interviewed because they want, when the final report comes out, to find out what other work other people are doing. So, you know, we'll figure out ways to sort of be sharing those sort of strategies. Three, do advocacy, you know, with CDC, HRSA, NIH, you know, to ensure, like, you know, continued support for ASOs, you know, as like the value of community-based work, and particularly community mobilization post-ACA, right? That you know, community-based organizations still matter, you know, even as we move things into more, we do work to sort of fix our sort of broader healthcare infrastructure. And then lastly, to generate more research on the role of community mobilization towards better health outcomes for people with HIV, or towards prevention for people most vulnerable to HIV infection in the United States. So those are some of the ways we intend to use this data and this research for, you know, for advocacy and for potentially for policy change. Next slide. So I just wanted to leave you with this quote. This was one of the groups that we interviewed in our project, and it talked a lot of this, I think, speaks to how you can use data as a way to tell a story about what's happening in your city. So this was Community Health Awareness Group in Detroit. One of the things they said to us, you know, is we can see the data, but clients tell you how to do it. They were talking about the ways in which they work with their community advisory board to develop their programs and their community mobilization efforts. So, so mobilization worked with our naloxone program. There were 245 heroin-related deaths in Detroit in 2009. When we started our program in 2010, that number dropped to 190 and kept decreasing until 2013. Then the city filed for bankruptcy, and our health department was privatized, and we lost our funding, which was $50,000. In 2014, heroin-related overdose deaths shot back up to 265. We know our program made a difference. So I wanted to just leave you with that quote. One of the things that's important to do if you're going to use data for advocacy work is to figure out what story the data is telling you. And I think this is a great example of how you tell a story with numbers, right? So, you know, next slide. And that's it. I guess we'll open it up for questions. This is my contact information if you want to reach out to me for any information about about.
Does anybody have any questions for Andrew or for Kenyon? Going once, going twice, going to Matthew. So Andrew, my question is actually directed at you. What is if someone's trying to figure out how to integrate more of their work with kind of navigating the science library, is it best if they get stuck just to call, to email, or should they just review these slides?
It really depends on how far they are in what they're doing. Hope I'm not too loud. Can you hear me okay?
Yeah.
Okay. Honestly, first step is take a look and see every page that we have, every one of our database resources always has a help section. There, like with PubMed, there are multiple tutorials which consist of short 1-minute videos. Say you're stuck on, like, I don't know how to do an author search in PubMed. There isn't actually it's a 2-minute video. You click on it and it will take you through it. That may be just enough to say, oh, I understand what I'm doing. I can move on. We have the full manuals down there that are searchable. Or if you feel more comfortable, sure, email, call within our standard, business hours, whatever is more comfortable for you. And if it's a time factor, obviously call, but again, that's standard business hours. If you're stuck at Friday night at midnight, it's a little difficult. But see what resources already exist on the page, and if not, then give us a call. We're fine.
So Kenyon, where would you tell people to go in terms of figuring out how to get evaluation work done, and they're trying to figure out, they know their program works, but they're not really sure how to evaluate it and how to support it so that a funder might take a look at them, or that they've been doing community or mobilization work and they can tell when they have funding that it goes well. When they don't have funding, it seems to dip. How do they kind of really show that impact?
Yeah, I think one of the things I think that people should do is, one of the things we ask a lot of organizations, in the research was how folks do their own evaluation to some extent, right? So how folks involve community both in the planning of whatever their programs or services before they even write grants, how folks are involved in the implementation of programs and services, or sometimes campaigns, and then lastly, how they evaluate. And I think some of the most, some folks have very close partnerships with academic institutions, in there, so the local, public health school, wherever they're located, actually, in some cases, they actually do their, the sort of evaluation work. A lot of times, sometimes public health schools are willing to do that stuff, sometimes for free because it's good training for their students in kind of program or project evaluation. And then some folks have worked with those kinds of academic institutions to just develop, some tools, or just to be able to do focus groups, to talk to folks about what the programs are, to have cabs or to have community, so, and if you don't have a cab per se, but to have some sort of community body of folks. So you just go out in the community and ask people if they've, heard of your organization, what they think, what they have, services there, have they heard of the campaign that you're working on, what they think about it. I mean, you can do really informal work that way, or you can email out surveys to use the Survey Monkey. I mean, we did the survey we did of the 335 ASOs and got 130 responses back. That was a Survey Monkey, right? So you can use your list to create a survey to find out things from your community about what's important to them, or what even folks who use your services, how they engage those, and then you certainly have to have the capacity either internally or again, a university or somebody you're working with to help you look at that and then figure out how you then develop either programs or campaigns or services from that point on. So I think there are a lot of ways to do it that it's fairly low, low tech.
Okay. A question from the queue for you, Kenyon, says, I would like to share your slides on the community mobilization role in the Texas Cascade with our local Ryan White Planning Council. How do you think I can explain to them how community mobilization fits with the kind of services that they are thinking about, like case management, et cetera?
Good question. So I think what I mean, I think that the one slide I mentioned that I stole from the Department of Behavioral Research in days that shows, the treatment cascade and then points to all of the different kinds of issues that prevent the bars from being higher. I think for a public health department, that's actually probably a really compelling kind of slide to have, because then it then, sort of speaks to the ways in which community mobilization becomes the way to kind of shift. If you're talking about a community that has heavy amounts of stigma, associated either with HIV or with whether it's sex work or drug use or being, an LGBTQ person, that if a community mobilization works that begins to break up some of that and create more opportunities for kind of community engagement and empowerment, that begins to break some of the stigma. That's part of the community mobilization, and also just the policy. I mean, the health department is probably not going to be as interested in the sort of policy change piece because they're often the targets, right? So I'm not sure how you make that argument to them in that way, but I think you can talk about community mobilization efforts that kind of create a kind of echo chamber in communities that begin to bring people who are most affected into the work that begins to sort of shift those dynamics. And if you want to get my contact information, we can talk offline about that as well.
Well, excellent. Thanks, everybody, for joining. And thank you again, Andrew and Kenyon, for joining us and making time. The recordings will be available by the end of the day. And if you have any questions, feel free to email me. My email is Matthew, M-A-T-T-H-E-W, R @blackaids.org. Hope everyone has a great day.
Thank you.